and we are going to jump into the content for today's webinar. So thank you all once again for joining us. And Jeannie, I'm going to pass the ball over to you.
Thank you, Vandy. Good afternoon, everyone. We always like to start our webinars with the promise of community action, and that's maybe even more important during these days that we're now experiencing. The promise of community action. Community action changes people's lives, embodies the spirit of hope, improves communities, and makes America a better place to live. We care about the entire community, and we are dedicated to helping people help themselves and each other. Thank you for joining us today. We have a really great turnout, and we're going to have a really good presentation from one of your peers this afternoon who's been on a journey of improving their practice and helping to make their community a better place to live, for sure. This webinar and the work that we're going to talk about today is really brought to you by the learning community at the National Community Action Partnership. And the purpose of the learning community is really to analyze community action outcomes and identify effective, promising, and innovative practices to really help support agencies that are trying to do better than they've ever done before and really fight poverty in their local communities. And over the years, there have been a number of different learning community topics, and the one we're going to be really lifting up today is a whole family approach and service integration too in many ways. The whole family approach team at the learning community at the partnership is led by Tiffany Marley and myself, Jeannie Chaffin, as a senior advisor to the partnership. Renetta Davis Armstrong joined the team a few months ago. Lil Dupree, you heard from Hyacinth or Zandy, and also Amy Roberge. So that's the team, and if you've been around a little bit, you've heard from one or more of them at different times. So the Learning Community Resource Center at the partnership is funded with a grant from the Office of Community Services, and the partnership also receives some funding from the Annie E. Casey Foundation that really helped support a community of practice that included 10 agencies, including Central Missouri Community Action that you're going to hear from today. And those 10 agencies were in a community of practice that was started in 2018. So they've been going at this a couple of years and really working together to figure out how they shift to a whole family approach. And we are very appreciative of the resources that the foundation provided to help this community of practice form and convene and get technical assistance and support and coaching during the last couple of years. So we have nearly 100 of different agencies on the call this afternoon on the webinar, and probably it's likely that some of you are very familiar with the whole family approach, and others maybe this is a new topic for you. So we want to just take a minute before Darren and Angela and Brooke do their presentation on sort of what this looks like at their agency, and make sure we all have some shared language and some shared knowledge about what a whole family approach is and why. And first, I'm really going to talk about why the national partnership, why really the field of human services has been focusing on a whole family approach, or you might also hear people talk about a two-generation approach or two-gen. First off, it's really about thinking about our future, and we all know that our children are our future. These numbers are pre-COVID-19, so you know, one thing as I look at these today, I can't tell you exactly what's happening out in America because of the pandemic and the economic crisis, but the last numbers that are really available, we had about 16% or 12 million children living in poverty in this country. And that group, those children in poverty, our youngest children are some of our poorest children, or children that are in the deepest poverty. 60% of poor children live in small cities, suburbs, and rural towns. And 2 in 3 poor children are in families where one or more of the adults are working. So we know that we have some real challenges related to the future of our country because our children are our future. And if you even unpack that a little bit more and you think about race and poverty together, we know in our country that by 2043, children of color will be the majority. And then we also know that children of color are really disproportionately impacted by poverty. So if you're thinking about the future of our country, and we know that our future lives with a lot of children of color, and many of them are growing up in poverty, that's really problematic. And we really have to think about how poverty impacts and undermines the health and development of children and the cost to our society. Every year that we leave millions of children in poverty, our nation experiences $700 billion in lost productivity, increased health and crime costs. So it really, really is costly. So we have this vision. I think those of us, those of you on the call this afternoon, that all makes real sense to you, and you understand the importance of creating opportunity for children. And when you start to think about what is the best way to do that, what's our vision for how we might achieve better results, achieve a better outcome than we've ever achieved before, you start to sort of see that serving children and parents together, really helping to create family well-being and a legacy that can be passed one generation to the other of economic and social mobility is really important. Accelerating social and economic mobility will help us achieve that vision. And we really have to think about what are the practices that might allow us to accelerate social and economic mobility. And sort of when you look at the research, when you look at the science, you start to come to this idea about serving parents and children together, or two-gen whole family approach. And a lot of times when we first talk about this, people say, oh, we do serve the whole family. But this is really about having outcomes for the parents and outcomes for the children. And when we say parents, you should also know that we mean caretakers. That might be grandparents, it might be an auntie or an uncle who's raising that child, but it's the child and the adult that is raising them. And it's really coming alongside them and having outcomes to help both generations improve their lives. It's really based in a theory that families have the potential to grow and change, and providing integrated, high-quality, intentional supports for parents and children at the same time will achieve better results than serving one generation alone or providing unintegrated, siloed kinds of services to children and not thinking about their parents, or trying to serve parents and not thinking about their children. I mentioned the science. This really is based on a lot of science, and one of the newer pieces of science is some research they're doing on young parents' brains, and what they're finding is that there's really a window of development in new parents. Their brains, we all talk about the 0 to 5 and the brain development in young children, but they're finding that the brains of young parents really have the potential to adapt and change. And so this report that's on the slide here from Ascend, which if you're new to this conversation, Ascend is a great place to look up resources and learn more. They call it 2 open windows. So the open window of the parent's brain and the open window of the child's brain. And so 2Gen really taps into that. And they're finding that those young parents, their brains are changing. They are changing the way they manage stress. The emotional bonding has an impact on the circuitry of the brain, and that promotes caregiving behaviors and parent motivation. And all of those things are so central to those sort of core ideas about parents being able to buffer stress and creating a stable environment during those first impressionable years, 0 to 5. And so 2Gen, working with the parent and the child, really taps into a lot of this sort of understanding. And so here again, also from Ascend, is sort of their 2Gen continuum. So really asking folks to think about what are the child-focused components, and in community action, oftentimes that may be a home visiting program or early Head Start. What are the parent-focused components that you have? Might be a workforce, might be housing, and how do you bring those together in in a whole family way where families are getting both of those services in a more coordinated, integrated, as some might say, it becomes a super vitamin for the family when you provide all that together. And so that's really what we're talking about today. And Ascend's theory of change is, if you take a family, and families look lots of different ways, and that's fine, and you think about providing early childhood, post-secondary workforce, health and well-being, income support, social capital, all of these domains, if you make sure that families are sort of have capacity and are building their skills in all those areas, then families will thrive and communities will thrive, because our healthy families lead to better communities and vice versa. So that's sort of the Ascend 2Gen theory of change, but sort of is a core for a lot of the work that's gone on in the 2Gen whole family field. And just a little bit more about those domains. Early childhood education, as I mentioned, could be Head Start, early Head Start. There's post-secondary employment training, so really helping parents to get the skills and abilities they need to create a family, supporting income into the family. Economic assets, health and well-being, and social capital, those connections that people have are really, really important. So just to sort of summarize some of the components, we often call these the hallmark of 2Gen whole family, really centering on the families. The families are the experts in their own lives, and we want to be co-designing with families, not sort of designing for them, but designing alongside with them. Integrating services, which really looks at aligning high quality. It does need to be quality services. It doesn't do us much good to integrate mediocre services. Removing barriers to getting services. A lot of 2Gen whole family work really uses coaching rather than case management. Coaching is really about helping people develop. If you think about athletics, people develop their skill, their muscle, and their aptitude through coaching. And that's what coaching, family-centered coaching does. It helps people build their skills in planning and problem solving, and versus doing things for people, which is somewhat more of a case management approach. Partnering, no one organization can do all those kind of things I mentioned before. You really need partners to help bring that whole array of supports to families. Really centering the work in equity, practices and policies that build opportunities for everyone and that remove barriers that are there for some people. And then measuring child, parent, family outcomes. It's really about having outcomes for all of the different generations and the different people in the family, which is very different in some ways than what many folks may be doing today. Finally, there is a 13% return on investment in high quality early childhood for each year of a child's life, and a college degree doubles a parent's income. So if you think about providing that early child care and the return on investment that can have with the kind of return that we see when we help people get additional skills and abilities, that is a really big return for the family and for communities and for our country. We have been trying to lift up some of the practice changes that our colleagues in the community of practice have been making. Several of the agencies listed here have done transformation leading through innovation webinars like we're doing today. Those are all posted on the partnership website. I think we have a couple more agencies, maybe Metro Action and Aroostook, who are going to present down the road. So look back at the presentations. If you love what you hear from CMCA today, look back at our earlier presentations from the other partners and plan to attend the future innovations. Because if you are sort of starting out on your journey, or even if you're early in your journey to shifting to a whole family approach, hearing what's happened with other agencies, I think, can really spur you on and help you, you know, ramp up your work more quickly. And then finally, I would just say, before I kind of stop laying the groundwork here, is, you know, we're in a very, very unprecedented time, right? None of us thought a few months ago that our economy would look like it does today, or that our health and our safety, that we would have family that are really at great risk of having health problems. And we're talking about, you know, changing our practice in this webinar today. And I know that many of you are in some realities of helping your communities respond to basic needs like food and shelter and utilities. And that is real. And, you know, we present this information to you about shifting practice, fully understanding that your capacity and bandwidth to do that is probably, it varies across the country. And there are sometimes little things that you can do to adopt whole family approaches. I was talking to Dr. Kroom from Metro Action Commission the other day, and she mentioned that, you know, they're applying their whole family lens to decisions they're making now about emergency response. So when they deliver food to a neighborhood park to feed their Head Start kids and other young kids, they're not just delivering food to the kids. They make sure that the whole family, there's enough that the whole family can eat and have what they need to secure really a basic health and safety issue. So that is a way to bring whole family to the current environment that we live in. So as you're listening to Angela and Brooke and Darren today, you know, think about what they've done, but also think about how you might adapt it to the current moment that you're in, that we all really do appreciate. All right, Darren, I'm going to pass the ball to you and the speaking baton, or Zandy will pass you the ball here. It looks like I can't do that, but there we go. I think you've got it. So take it away, Darren.
Hopefully everybody can hear me. You know, I would never have thought of presenting to a community action partnership workshop wearing my pajama pants, but you know, it's a new world, and I'm sitting here in my attic office and working virtually, as many of you are probably doing as well. I do want to sort of reiterate some of the points that Jeannie made just very quickly. I'm very impressed and pleased that all of you are joining us today. It's challenging to think about the future and our long-term plans when we are roiled in a lot of crisis in our communities today. But I think that's what thinking about a whole family approach is all about. Jeannie laid out a lot of the components of community action, or of the whole family approach. And I think it's our job to kind of talk about how that translates into real world applications. So we'll talk just a little bit of context about Central Missouri Community Action, and then we'll talk about some of our processes and experiences and outcomes to share with you. I do have to dwell on the promise of community action just one more time. It's a statement that we repeat often and recite it, and I think living the promise is a bigger challenge than just saying the words over and over. But like Jeannie said, they're no less important, and probably more so than they ever have been before. And the whole family approach is a great way to live the promise of community action. Like I said, so Central Missouri Community Action is in many ways a very average organization across the network. It's interesting. The series is called Leading Through Innovation, and I love getting the label of being a leader. But the fact is, we're very similar to community action agencies all across the country, and we've got many of the same challenges and many of the same opportunities. And there's no reason to think that everybody can't embrace a whole family approach, because the pieces are there. You just have to dig into the weeds of the complexity of it. So just a little bit of context for Central Missouri Community Action. We're based right there in the middle of the state of Missouri. If you've ever seen Missouri before, most people refer to it as the flyover state. But we are in the middle of the state. Our middle county, Boone County, is where the flagship of the University of Missouri is. Go Tigers. And just to our south in Cole County is where the capital of our state is, in Jefferson City. So those two areas are relatively large metropolitan areas, and then all of the counties around us are extremely rural, very spread out, heavily agricultural. There's some meat packing processing plants around us, very typical type of rural settings. So I point this out just to say that again, we have a very mixed geography that is, I think, fairly representative of our broader network of community action agencies. You see there the approximate size of our community, and then a listing of our programs. You'll probably recognize a lot of these programs that you operate as well. I'm going to dwell on, or just for comment a little bit further on two of them. One of them is the Missouri Women's Business Center. We're very proud to have started this program. It's a small business administration funded program. Several years ago, we were trying to help small businesses get started by initiating a micro-lending program. We found out very quickly that lending is not our forte and not really our wheelhouse, but coaching and teaching and training and building relationships with people to enhance their business processes is very much in our wheelhouse. And so through this program, just in the last couple of years, we've been able to help over 40 businesses get started and access over about $1.5 million of capital to start those businesses. The program is not, it's not income eligible. It's anybody can come to this program, but we are stressing, obviously, the role of low-income business entrepreneurs, and about half of our clients are within that CSBG eligible criteria. Then over in our child development programs, many of you have Early Head Start and Head Start. I think those are the quintessential 2-gen programs. I mean, they were designed to focus on the adult as much as the child. What we found, though, and we'll talk about this more through the presentation, is that most of the work we were doing with adults was really for the purpose of increasing child outcomes. And through this whole family approach process, we've really doubled down and said we've got to make sure that the adults are reaching their outcomes and their goals as well. Because if we're raising children in unstable households, all of that great work in Head Start is going to be mitigated by ongoing economic instability. So that's kind of where some of our whole family thinking has gone. The Bridge is a relatively unique program. I've always said that Head Start is a fantastic program, but all of those great child outcomes kind of, they don't go away, but we stop tracking them at kindergarten as they enter public schools. And we know that families aren't necessarily okay just because they finish their Head Start program. Many of them still are struggling with a variety of issues that you all are aware of. So we developed this program called the Bridge, and the Bridge is the connection between public school teachers and the parents of Head Start graduate children. So we're working directly, we're training kindergarten teachers, first grade and second grade teachers on the realities of poverty, working through poverty simulations, working through trauma and toxic stress, really just talking through those realities of poverty so that they can understand some of the challenges that their students are experiencing and not, chalk up misbehavior to it's just a kid who's misbehaving, but to really understand that there's probably a broader and deeper dynamic going on there. So we're working with the teachers on one side, and on the other side, we're working with those parents to really help them feel comfortable in the school environment, to make sure that they're going to those teacher conferences, to make sure that they're engaged in their PTA programs, attending events with their children, and really getting comfortable in that environment where they might not have had that level of comfort as they were students. And then throughout, we're still working with those children, making sure that we're addressing any crisis, really working with both the teachers and the parents and the kids, to still establish goals and work towards them. And we're seeing some tremendous outcomes. Some of the goals we set in place are improving attendance, decreasing disciplinary referrals, and overall increasing the level of engagement. And we're seeing all of those in spades. So it's been a very productive program, and it fits perfectly within the whole family model. And we use the same coaching model in whole family that we do in the bridge. So it's a nice connection. And so there's a snapshot of our budget and our agency size. As you can see, we're not only in the middle of the country, but we're also pretty average in terms of size of organization and number of employees. So hopefully many of you can relate to us as we go on through this program. So many of you will cringe when I say strategic planning. I know that my team probably is, but it's important to kind of go back to think about how we got to the whole family approach. We do strategic planning every 3 years, and we've set goals for our programs and services. And I really came to the point where I felt like that was a disingenuous process, because essentially, we're setting outcome goals based on our funding, and we serve people the best we can, and we hit those numbers, but it's totally based on funding. So in our strategic planning in 2017, we kind of said, let's think about what we need as an agency. How do we improve as an organization to make sure that we're meeting the needs of families and improving communities, and again, living that promise of community action? We really kind of agreed that when you do your strategic planning by program, you get program outcomes, as opposed to doing strategic planning for the agency, which is setting the foundation and creating the platform or doing anything else you want to do through the process. So we've been toying with service integration. I've been at CMCA for 15 years now, I guess, and we've been playing with service integration from day one, because we all recognize that we have all these really valuable programs, but if we can't connect the outcomes to each other, then we don't really know what the overall effect is. So we've tried things like the no wrong door, trying to figure out our data systems to unify all of our data. We did consolidate our non-Head Start programming under a chief program officer. That's been a very effective strategy, but we struggled still throughout. And the whole family approach was really our first opportunity to see service integration get legs. It's been an opportunity, just by necessity, we've had to bring all of our programs into the whole family approach. So that was in 2017, and our idea at that point was we were going to pilot a whole family approach in 1 or 2 Head Start classrooms. So that was a great idea, and right around that time, we lost the bid for one of our major employment and training programs called the Missouri Work Assistance Program. So we had a lot of staff who had been coaching on employment skills and training, who suddenly had no program to attach them to. And so we made the questionable decision to go whole hog, and we said, okay, we're gonna do a whole family with all of our Head Start families and our working housing choice voucher families. So about 700 families that we were talking about jumping into. It was kind of an insane decision, but it was a little bit out of necessity, because we had great staff. We wanted to keep them. We wanted to put their skills to use. So we thought, we'll just pivot and do this whole family thing. And so we had from October of 2017 through December of 2017 to establish our whole family approach. And then we started on January of 2018, which was a very, very fast process, and it led to some challenges along the way. But I'm going to let Brooke Eskridge, who is one of our family administrators, talk about that initial process, that first year of just implementing, because we knew it was the right thing to do. We'd been reading some of the Aspen Institute work, and we were committed to trying this model. Jumping in with both feet was a little scary, but it has worked great. And I'm gonna turn the microphone over to Brooke so she can talk about that initial stage.
Hello, hopefully everybody can hear me. So yes, like Darren said, we did jump in with both feet, and I feel like we really have not slowed down since that time. So the very first thing I want to talk a little bit about is revised job descriptions. So in this change to whole family approach, the leadership team decided there would be 2 family and community administrators. And Tammy and myself were asked to be those family administrators. Now, Tammy comes from the Head Start world and doing everything early childhood. And for myself, the 15 years that I spent with CMCA has been employment and training and also CSBG work. So we had to learn each other's programs in order to be able to train staff. Along with that came what we did call family development specialists, as well as family advocates. And we brought them all together. However, they all had very different skill sets. Some of them had been working in employment and training programs. Some of them had been in Head Start classrooms or even operating as a site director in Head Start. And some of them had been working with partners in our early Head Start. So a very interesting dynamic, you know, with this group. They had some relationship with Tammy and myself, but a lot of our first 6-7 months was really getting to know our new team and helping everybody build rapport together and learn from each other. So the job descriptions changed in really moving towards that coaching mindset, like Jeannie was talking about before, you know, case management versus coaching, and what is coaching? What is whole family approach versus the family development is what most of our programs referenced it as instead of case management. And what is that going to look like with our new families? And so we established a training plan. Angela, our Chief Program Officer, and Beth, who is our Early Childhood Director, and then Tammy and myself all worked together, had so many meetings, and figured out what do they need to know. We came up with 24 different areas that needed to be trained on. And this is everything from, you know, taking care of yourself when it comes to doing this hard work with families, so compassion fatigue and motivational interviewing and what that is, all the way to, you know, more program policy type of training and database training. We knew that our staff were going to be expected to use 2 databases on a very regular basis. And a lot of the training had to focus on, you know, how do you, you know, put in the data correctly so we can get good outcomes. Along with that, we had to look at the logistics of office location. So when we first started in 2018, it was really February when we started our training plan. And when I say intensive training, I mean like it was a few times a week we were together doing intensive training. But where were people going to be located? So about half of them were located in Head Start centers. And the other half were located at our family resource centers, which we have in 7 of our 8 counties. And then right about the middle to end of the 6 to 7 month training process, we also found out about an opportunity to bring an employment and training program back into our agency, which is called Skill Up here in Missouri. And that's working with food stamp recipients, so those SNAP recipients. And so not only were they learning Child Plus for Head Start and our internal system for the state called MIS for everything CSBG, but they were also going to be learning Skill Up. So we're talking about a lot. There's a lot that were put on our coaches' plate, and we really had to be mindful of caseload size and geographic locations, traveling that was going to be required, and being innovative when it came to, you know, could we do some online meetings? You know, now this is like normal for the last 2 months. But 2 years ago, you know, that wasn't something we were doing a lot of. So we got used to that as well. And then constant communication. So, you know, Tammy and I at that time in February, we knew each other in the agency, but we basically, we started working together on a daily basis and communicating to make sure each other were, you know, caught up on everything that we needed to know, using each other as a mentor and really leaning on each other. And I think that point is important for me anyway, as a family administrator, kind of overseeing this whole family group, having that support and it not being a one-person job. You know, everybody always says, you know, you bring more brains to the table, you know, you have the big ideas, but it couldn't be more true in this case, because my expertise and her expertise were vastly different, but the amount that we've been able to learn from each other, I feel like has only enhanced our ability to train our team and really see their professional growth over the last couple of years. So like I said, that first 6-7 months really focused on building rapport with our new supervisees, building the new team, teaching them, well, I can't even say teaching them, but really introducing them to a culture change within CMCA and trying to truly break down those silos. Everybody knew that we had certain programs within the agency, but not everyone knew how to access those programs, the application process for programs, you know, the eligibility requirements for programs. So all of those different aspects had to be trained. One of the biggest things that we took on was a new family assessment. And we are going to talk about that in some future slides, so I won't spend too much time on that. But a lot that went into that was being able to do that family assessment and training them on how to do it in a style of motivational interviewing instead of a question and answer type of situation, and then how to score that properly, which we will also talk about what we learned from year 1 to year 2 here in a few more slides on that self-sufficiency matrix. And then as we started the year, and we started in September of 2019, which we picked that start date because it coincided with the Head Start school year. Our full intention was to bring in our Head Start families, but then also our Housing Choice Voucher families, or what some people refer to as Section 8. We had some mixed results there. So, and I believe Angela's going to talk a little bit about that in a little while, but our Housing Choice Voucher families were a difficult population for us to initially get on board with the idea of whole family approach and helping them meet their adult goals. It was also difficult on the Head Start side, getting families to see beyond child goals. So that culture change that I mentioned a few minutes ago, that was not just with staff. And it still isn't. We're still educating not only staff, but also those members that we serve, what the whole family approach is. We've changed the way that we do orientations to be able to, you know, really explain up front that Head Start is not childcare. Okay, it's so much more than that. And we want to see outcomes both for your children, but also for the adults in your family. And that's where that 2-gen approach comes into play. We also realized that we needed more people on board with this culture change. And Darren was doing a great job of sending out updates and his weekly leadership links, and each of the directors were talking to their staff, you know, programmatic. But then we came up with the idea for a whole group to meet that included all the program managers as well as those frontline staff doing what we came up with, drivers, soldiers, is the title of that group. It becomes a tongue twister when you say it fast, but the idea there was we have to be able to learn from each other, and part of that is breaking down those silos on at least a quarterly basis, everybody's seeing each other's faces, because we're also used to operating kind of within our own program bubbles, if you will. And that first meeting was in January of 2019, and then we've continued those and continued to get better at what those look like since then. So Tammy's going to talk a little bit now about where we went from the end of our school year in 2019 and then into the summer of planning and beyond there. And then you'll hear from me again.
Okay, so can you guys hear me? Okay, I see Angela nodding. Good. Okay, so we do the self-assessment through Head Start every single year around May and June. So when we were doing our self-assessment data review, we realized that many of our family assessments or our self-sufficiency matrix, and as Brooke said, we'll talk more in depth about this later in our presentation, we noticed that the scores were very high for our targeted whole family approach members, and those whole family approach members are our Head Start income eligible families. And so from there, we developed a questionnaire, and like Brooke said, using that motivational interviewing, using open-ended questions, we asked that the home-based administrator and our bridge coordinator also join us in developing this questionnaire that we could use, because they have staff that are also using the family assessment as well, and we have shared families through the bridge program or through Early Head Start or through home base. And so the shared families, so we just wanted to double check, we wanted to make sure that we were working together on that. We wanted the self-sufficiency matrix or our family assessment to be administered the same regardless of what program was using it. And we determined we only needed an initial assessment and an exit. So we were doing the assessment 3 times per year in 2018. And from our self-assessment, we identified we only needed to do it twice. Due to the data that we were collecting. 2019 in July, we were also awarded 3 additional counties to provide Early Head Start home-based and Early Head Start center-based and Head Start center-based. And so that kind of threw us into a different type of training. We provided intensive training for those new staff. And in that area, we were gaining 3 new additional family success coaches too, that would need intensive training as well. That particular year in 2019, we started with pre-service training in August, and we developed a role play that the family success coaches could actually watch. So Brooke and another person, Jennifer Colostrum from our Bridge program, they provided the role play for all the coaches to watch. They were able to score the assessment during the role play by watching Jennifer and Brooke's interactions and what they were saying. And we wanted to do intensive training with them to make sure that we were looking at the prevention line for families who score at or above a 5. We consider those to be stable, safe, and thriving, and we'll look more at that in just a little bit throughout this presentation. We wanted to make sure that the training was intense so that they would know how to score the family assessment. And we wanted to make sure that those scores reflected the client or the member's current situation for each domain. So in other words, the domain should not be scored based on the client's or member's recent past or pending changes, but it should be based upon their life circumstances today. We also developed a reliability test, was created for the coaches. And then we also had about 6 positions that turned over during this time as well. That was about through a 6-month time period. So we were, again, training and retraining people. We also retrained on MIS because we started to do an agency intake, and we also increased data entry for tracking services and referrals. And we really wanted to focus on adult goals versus child goals, like Brooke had mentioned. We did not have a focus on housing choice voucher families unless they were a member of the whole family approach. and we were already working with them. There was no outreach effort to engage more housing choice families during the 2019 or 2020 program year, which we're getting ready to come to an end pretty soon on that program year. And like Brooke said, we were doing the Shriver Soldiers quarterly meetings. And then we also had Skill Up was devoted, we had 2 coaches devoted for Boone and Cole County. While everyone is still responsible for the outreach for the Skill Up program, we have primary coaches in Boone and Cole. And Brooke, do you want to talk a little bit about Leslie's position?
Yeah, I will. So when we first got the Skill Up program to kind of add that to the toolbox of whole family, our understanding was that it would only be about 6 to 7 months, and we would be done in May of 2019. However, we were given the opportunity to extend that, and of course, you know, employment and training, we wanted it. But with that came some more programmatic changes, because I quickly realized that as our enrollments were going up, the monitoring requirements for Skill Up was huge. And just the day-to-day oversight and answering questions was a 40-hour-a-week job in itself. And we needed help there. And so we took one of our other staff who is also, you know, has had years in employment training, and she became the program coordinator to manage the program and oversee it kind of at a bigger level, and was able to do the day-to-day work for me and do the monitoring portions for me. I'm able to focus on whole family. But like Tammy said, that turnover that we did have, you know, we had 12 coaches and 6 of them turnover in that summer of 2019 through the fall. That was huge. That definitely made a difference in how we are moving forward now. Basically, the leadership team and our COP team at CMCA saw that Tammy and I were doing a lot of the day-to-day work of the coaches, because if a position was vacant and we were in the process of hiring it, then we took on that caseload. You know, and then Tammy was also trying to train in those bottom 3 counties. And at one point I was bouncing between 4 different Head Start sites. And so that makes it very difficult to be available as a mentor. We did it, but sometimes with very, very, very long work weeks or work weekends or whatever you want to say there. So in our present planning for, you know, moving into ending our school year, we will plan all through the summer to start our next year whole family approach. But we are looking to change the supervision structure, where our coaches will be supervised at the sites. So our site directors for Head Start will be taking over supervision, and Tammy and I will be able to operate truly as family administrators, doing the monitoring, doing the mentoring and coaching, and still having regular, you know, monthly meetings as we have for the last couple of years with just the coaches. But our jobs won't be quite as much in the day-to-day work of, you know, family development and whole family approach. We're also looking to add a new family success coach in the Cooper Howard area. And then we're looking at refocusing our efforts on housing choice voucher. We saw some of the flaws on our initial efforts, and we are putting a plan in place to change that and really try to do more recruitment and bring in our housing choice manager to the team to be able to tell us, you know, how is the best way to engage them in whole family approach where they can see the benefits of it.
where we're Jeannie. I'm wondering, we are getting some questions coming in, so I might just surface one of those questions and then pass the baton over to Darren or Angela, if that's okay.
That's great.
Okay. Darren, you had a question about how you were funding the Bridge program, so if you want to go ahead and answer that, and then we can pick up on the next slide.
Sure. Am I back on?
Yes.
Yeah, so the Boone County, which is that county in that picture that was in the exact center, that's one of our larger counties population-wise. They passed a children's mental health sales tax back in 2015, and it was a quarter cent sales tax that they added on that was solely dedicated to mental health issues. And we made the case that by working with children and families beyond Head Start, that we were having mental health impacts. And so we've had funding from them for, I guess we're in our second 3-year cycle now. So we spend about $200,000 on that program, and it affords 1 manager and 2.5 FTE that act as our coaches. So moving on, I think that Brooke and Tammy basically just gave the rest of our presentation and did a wonderful job at it. It's a funny analogy because in 2017, I said, let's just do whole family, and Brooke and Tammy took it, and they did it, and we were off and running. But we did recognize that we had to take a step back and really think through the process and make sure that we, now that we're doing it, now that we're running this program, or using this approach, that we want to make sure that we can actually measure it and track our progress. I think one of the things that Brooke said that I really want to highlight, and that is the fact that if you think back on one of Jeannie's earlier slides about the Ascend Institute, Brooke is coming at this from a employment and training and adult perspective, and Tammy is coming at it from a family and child perspective. And they really were pushing towards the center, the whole family approach. And I would encourage all of you to think through in your agency, what kind of leaders do you have that come at it from those different perspectives, and just put them in a room and say, what do you think is important about our work? Because getting those two together, I mean, like I didn't even know exactly what we were getting into until I heard their conversations about the value of this work, the push and pull of child versus adult, and really thinking through how we can bring all of our programs to bear to provide support for all of the families. It was a really valuable experience and exercise. I would encourage all of you to consider it. So I'm one of those executive directors that sees a shiny thing and I jump for it. And I saw the community practice application come out in, I don't know, December 2017 or so, somewhere in there. And I said, we got to do this. This is going to be, it's the perfect timing for implementing our whole family approach. And then I let everybody else do the work. Probably many of you understand that process. But that's what we did. We joined the community practice. It has been such a wonderful experience. And there are downsides to it. It is a real commitment of time. I mean, we did 2 webinars a month. One was we called Sharing and Learning, where we're interacting with all 10 of those agencies that are participating in this particular community practice. And then we had one that was just a knowledge, like a topic would be delved into, like one of these webinars. And so that was a time commitment in its own. And we realized somewhere along the process that we also needed to make sure that we were doing our own internal planning separate from the work of the webinars. So you've got those couple of hours on the webinars, but you also need to make sure that you've got scheduled, planned time to think through all of the issues that are on this slide. And in the case of the community of practice, these sort of came to us in the form of homework. And that was really important because that sort of gave me the justification to stay involved as an executive director, where, everything else in my life was pulling me back out of it. But that helped me to stay in and hear the conversations and listen to the guidance that I was getting from our team. So the next couple of slides, we'll go through these different components of our next level planning. And the first, of course, is a theory of change. You saw the Ascend theory of change about what it takes to make a family resilient and whole. And this is our version of it. And so the process, you know, basically we said, what do we want for families? Like, what's the point of all of this? And ultimately, we said that resilient families is it. We talk about resilience as a measurable proxy for hope. You see hope show up in our promise of community action, and it is a central tenet of resiliency. But hope is not measurable. Resiliency is measurable, and we'll talk about that through the self-sufficiency matrix here shortly. But you can see the goal there in the center is that resilient family. On the left, you see that social mobility is part of this goal, and we're progressing towards thriving communities because we're trying to make America a better place to live by improving communities. So when you break that down, and when you think about these different areas, social connections, family well-being, and economic stability, none of those things have anything to do with income. So we're not saying you have to make $50,000 a year for your family to be resilient. What we're saying is you need to have these components. And this is, again, just our theory, and it's worth thinking through how you think about it. So we took this theory of change, and then just our next step was to plug in all of the programs that we were operating at that point and say, where do these programs fit into the different components of our theory of change? So you see things like Head Start fits in all of them. So you see that repeated. Other programs like housing assistance really falls into economic stability, or energy efficiency falls into economic stability. So we've got different components, and we just wanted to lay it out like this so that we can see what are we doing to get towards this model. So from there, we did a logic model. I'm sure you can read that very well. Yeah, Jeannie likes logic models. I don't know if you can see her or not, but she's raising the roof. So the logic model is the first step towards moving from a theoretical approach, our theory of change, and moving that towards having data, evidence, and proof of effectiveness. So we started, you probably can't see those columns there, but the first column on the left is assumptions. So we talked about what do we think is true about social connections, family well-being, and economic stability. And just as an example, again, since I know you can't read that, the assumption around social connections is families who are active in their community and engaged in their own well-being will be less isolated, more likely to have access to supportive services and resources that give them opportunities to thrive. So that's the assumption that we're testing through the next set. And then the components of that are leadership development, relationship skills, and civic engagement and community involvement. And then the next column is short-term outcomes, like improving leadership skills, like improving English language skills, improving support systems, increasing access to services. Those are some of the short-term outcomes that then lead to the long-term outcomes over on the right of resilient families, social mobility, and thriving communities. And then the next step, obviously, is then establishing what services are we applying to reach these outcomes. So that's the start of our process. And then we realized that we didn't have so we have a management information system that allows us to track data, and we use Child Plus for tracking child outcomes, but we didn't have any way of having a really good picture of how we show the measure of resiliency. So we did some research, and we looked around. We went through the Aspen Institute, and we found this model out of the state of Washington. And I'm going to let Brooke, I think, is lined up to talk a little bit about the components of our self-sufficiency matrix.
It's me, it's Tammy. I'm going to do this part.
Great.
So there are so many different quality assessment tools out there, but we chose this one as a team because it did cover so many different domains, not just basic needs areas, but also like life skills and things beyond the basic needs. And it also was it was tested, it was reliable, and it was valid. And it also promoted like a client-centered focus, and we didn't have to reinvent the wheel. I talked about earlier that we developed a role play that the family success coaches could watch and then score. So if you want to go to the next slide, Darren, so we can look at that. So this is what we wanted them to look at and to score. We did intensive training on the why behind the score, And through that self-assessment, when we were looking at that, we found that so many of our people had scored it so high. So we really wanted to talk through that with them to make sure that, like Brooke had talked about, like when staff left, when we were stepping into those positions, or if someone went on maternity leave, we were stepping in. So we wanted to make sure that staff were scoring that very similar, and that we knew that all staff, after being trained and taking the reliability test, that they would score it very similar. And we focused a lot of our training on the prevention line, and as you can see, the prevention line is below 5. And so through our training, we talked a lot about setting those goals and focusing on those with families or with parents, guardians that were scoring below that 5. So now we're at that point where our family success coaches are now completing the exit scoring for this, and then we'll be looking at that data again in June. Okay, you can go ahead and go on, Darren.
And so I'm pleased to turn this over to Angela Hirsch at this point. She's our Chief Program Officer that I mentioned earlier. So everything in our agency other than Head Start falls under her management leadership. So Angela, take it away.
Thanks, Darren. Good afternoon, everybody. So as Darren mentioned, my role within the agency is to be a jack of all trades and make sure that our families not only have access to the programs and services they need, but also that our programs and services are what they need. So we had an opportunity at the same time that we were putting together this new agency culture of whole family to work with the Annie Casey Foundation on a data governance pilot project. And when Darren first brought this opportunity to me and said, hey, I want us to be a part of this, my first thought was, really? Another one? All right. But it really ended up kind of fitting hand in glove with the work that we were trying to do and process that we were trying to put together with whole family, because we didn't really know. We knew we needed data, but we didn't know exactly what data we needed. We didn't know how we were going to collect it. When you're trying to bridge together programs like Head Start and community services and housing, and all of the different things that we as Community Action do, you all know that most of our programs tend to speak different languages when it comes to outcome measures and when it comes to systems that you use for those outcome measures. And this opportunity with the Annie Casey Foundation really gave us an opportunity to focus on what is it that we truly want to know as an agency. So we threw data parties, and in our data parties, we brought together every single program and asked the questions of what data do you collect, how do you collect it, why do you collect it, what are you looking for this data to tell you, and what does it actually tell you? And we found out that in almost every instance, we're all collecting the same things. We're collecting them in different places. We're storing them in different places. We're not sharing that information with each other. And 9 times out of 10, it's because that's the data that the funder wants us to collect, not necessarily the information that we want to know or the information that tells us, are our families truly becoming more self-reliant? Are they becoming more resilient? And how are the communities responding to that when it comes to addressing issues of poverty? And those were the 3 questions that we as an agency want to know. Are the programs, the initiatives, the services that we are providing making these 3 things happen? Are families more self-reliant? Are they becoming more resilient? Are communities taking a more active role in identifying and addressing the issues that are related to poverty? And if the answer to any of those 3 are no, then the question comes to be, then why are we doing it? So So as we worked through the governance and that, that really helped us answer the question of our tangible results and where do we want to get to, and what are we trying to do. And Brooke had mentioned the change in our agency culture. It wasn't just a change to our agency culture. I'm going to call it a shock to our agency culture. Integration is a great word, and Darren had mentioned, you know, for the last 15 years, integration has been something that we pushed. When I first came to CMCA, we actually had an integration coordinator on our staff, and her whole job was to integrate the entire agency. Well, here we are 15 years later, and you know,
I might point out that's a really bad idea to have one person whose job it is to integrate the agency.
Yes.
It takes a culture.
So in looking at the whole family approach and really recognizing that the whole family approach is not a program, it is truly a method of providing services to families. And looking at what does that mean, we really had to change our mindset on many different things. It wasn't okay, Head Start, you focus on kids, and okay, family development, you focus on the adults, and okay, housing, you focus on the vouchers and getting a roof over people's heads. It was about bringing all of that together. Brooke mentioned the Shriver Soldiers group that we put together. This was the first time all of these staff from our agency, Darren mentioned the 220 staff we have across 11 counties, really looking and giving them an opportunity to learn from one another, talk to one another, understand one another, and recognize and see how the work that I do in a Head Start classroom impacts the work that my colleague does at our Family Resource Center, and how not only how they impact one another, but also how they influence one another. So the integration just kind of has started to come naturally. It is not without its growing pains, and it is not smooth, but it really starting to look at how do our teams work in our 11 counties, because every county is different, and how do our employees define themselves? You know, I think a lot of us recognize that when you hear staff talk, you know, a lot of times you'll hear somebody who will say something like, you know, I'm Angela and I work in the Howard County Head Start program. And our effort is to change that from I work in the Head Start Howard County program to I'm Angela, I work for CMCA, I move families out of poverty. That's what we do. Another huge piece of our agency culture was the trauma-informed piece that Darren had mentioned earlier, and recognizing this as a priority for our agency, not just in working with our families, but in working with each other as staff, in working with our colleagues, our supervisors, et cetera, and really recognizing that this work is hard work, and that the trauma that our families go through and helping families through those crisis situations, the effect that that has on us, and how we can do better at supporting each other, how we as management can do better at supporting our staff as they are doing this work. So it's an ongoing effort. Along with our agency culture change, we had some serious structural changes. We had, you can see here on the screen, these 5 different positions: child and family development advocate, teachers, family advocate 2s, family development specialists. All of those were combined to become what we now call our family success coaches. These are our coaches that work one-on-one with families. All these different positions in the past had done that one-on-one work with families, but they each did it a little bit differently. Now there's one, the family success coach. The intake and referral process that we had gone through was really only specifically targeted one aspect of individuals that came in through our agency. It didn't really trickle over to the Head Start side of our agency. So that intake and referral was basically taken out, and that has been revamped to a full agency intake that represents the first thing that families do when they come to us, regardless of why they come to us or what door they come through. And that initial agency intake helps us identify why they're there, how many are in the family, what's that immediate need that brought them there, and then where do we go from there? And then, as Brooke mentioned earlier, her role as a program officer focused on employment and training, and Tammy's role as a family and community partnership administrator focusing on early childhood and Head Start, came together to form what we now have as the family administrator position. So with all of this, as we move and we're changing structure and we're changing culture and we're changing staffing, we're also changing our funding, not necessarily the funding that we get, but how we use it. Our funding within our agency has become very braided. And as Darren says, you know, braided funding makes systems knotted, because every funding source has a separate database system that we are required to use as an agency. And I think that this is something that those of you who have started with the whole family approach recognize, and that anybody in community action probably recognizes. 50% of our coaches' salary is paid out of CSBG. CSBG in the state of Missouri has the requirement that all information, outcomes, services, goals, etc., are documented in what we call the MIS system. 25% of our staff are paid through the Skill Up program that Brooke mentioned, the employment and training program that we have obtained. That works with our families in terms of our adults, working with them to help them find skills needed for additional jobs, whether that be education, on-the-job training, etc. But Skill Up also has its own state required system that we have to use to document the work that's done with individuals enrolled in the Skill Up program. And we also want that information documented in, again, our own agency MIS program. Our weatherization program, this surprises a lot of people that we pay our coaches out of weatherization. But the fact of the matter is, weatherization plays a huge role in the safety and security of the homes that our families are living in. And we want to make sure that they have not only access to that, but an understanding of what the program is. So by having our staff pay partially through the weatherization program, they can help families access those weatherization services, walk them through the application process, work as the go-between between our contractors and our weatherization staff with the work that's happening in their home, etc. But again, in the state of Missouri, weatherization has its own state-required system in which they want information documented. And again, we want those details of how that work is being done with families documented in our own MIS system. And then finally, Head Start and Early Head Start is actually the smallest percentage of funding used to support our coaches at CMCA. Not because it's not a very important piece of it, but because with our coaches, our primary focus are on the adult caregivers of those children. So we're focused primarily on adult goals, adult work, adult services. But even so, that work with the adult caregiver is documented within the Child Plus system as a requirement of the Head Start program, and making sure that that information is clear and concise. So when you're working with staff and you're braiding this funding and they're providing these different services, there are these different requirements, if you would, that come with that. So we are in the process of trying to figure out how do we make it easier for our coaches to access and utilize all of these different systems, get the information because they're the ones providing the direct service with the families in a way that it doesn't become cumbersome. And as soon as we figure that out, I will let you know. That's an ongoing process for us at this point. So how does this all work, and what have we seen over the last 2 years? Well, what we have seen is that truly the whole family approach really does improve social connections for families. And our coaches work with adult members of the family in numerous ways, but through the social connection piece that we believe is vitally important to help families achieve resiliency. We work with the adult members of the family to build their leadership skills, improve their relationship skills, and to develop skills that lead them to that civic engagement, because we believe that families who are active in their community and engaged in advocating on their own behalf will be less isolated, and then they will have more access to supportive services and resources. And we've seen that happen when we look at not only the child development goals that have been achieved that you can see here, but also as you go through and you look at some of the adult needs that are met and that are obtained. So when we look at the self-sufficiency matrix variables from the first year, which was 2019, fiscal year 19, we see that for that first year, these achievements were gained with families throughout this process and by utilizing this service delivery method. At the same time, we also see that families, more than 50% of our adults whose children were enrolled in Head Start received some additional supportive service that was not addressed through the Head Start program itself. These are things that might have happened. I'm not going to say they never happened with Head Start families prior, but it was much more intentional utilizing the 2-gen approach that we now utilize. And so helping access and connect families with these additional services, with the adults with these additional services as they went through the year. Our members are coached on different strategies that are designed to increase income and asset building. They're also connected with different opportunities throughout the community that can build their financial goal setting skills, and our coaches help them remain accountable to meeting the goals that they set when it comes to their financial future. And so using the opportunities and resources that we have within the community to help families build better financial stability has really been an asset to us and to our families as we work through the whole family approach. The data from fiscal year 19 shows that these self-sufficiency results were achieved through the measurement of our self-sufficiency matrix. In fiscal year 19, we served 326 households in our whole family approach method. And these were the results of that first year with those families through this process. I will tell you that I don't think that our data is complete at this point. I think that we really need to look at, again, going back to the different, all of the different systems that we have to use because of funding requirements, but also really focusing in on how are we collecting that data? How are we translating that data? And again, going back to those original 3 questions in terms of, is this data telling us what it is that we really want to know?
So I'm going to take it back over at this point. Can you hear me?
Mm-hmm.
Okay, good. So we've talked about all of these, but I wanted to just comment briefly on the creative tension among our community of practice. So that's our team here of planners. You've heard from Tammy and Brooke and Angela and I. Our Head Start director is also a participant, and one of our program managers who really manages a lot of our data system was also involved. And I mentioned this earlier with Brooke and Tammy, but I think it's really important to bring different perspectives and professional experiences to the table. It made us better to challenge each other to think about what our purpose is. And so that creative tension really stems from having an adult approach versus having a child approach. And it goes back to that Aspen theory of change, and really looking at how those two creative tensions can push against each other to make a better whole family approach. And that's one I think you should look for. If you've ever read the book about Lincoln called Team of Rivals, I think it's a great example of bringing different political perspectives to the table to solve problems. This is bringing a different experiential group of people together to really think outside of the box and figure out how to make all of this work. Because while it's very intuitive, it's very complicated. So just trying to wrap up here quickly so that we have time for a question or two. Next steps, we have to continue to evaluate our own processes, continue to evaluate our own data. We have to continue to clean our data to make sure that it's telling us what we think it is telling us. We're finding a little bit of variability in terms of when somebody puts in their case notes what they're doing with families, it doesn't actually show up in their service data input. So we've got to make sure that the data is clean and is really telling us what we need to know for ongoing management decisions. We are going to bring more financial work to the table. I think that's going to be even more important with the pandemic going on and the increase in unemployment and decrease in wages. We want to make sure that people know how to protect their assets, how to work on credit repair, how to do a family budget based on whatever income they have. So we're going to be doubling down on our financial opportunity work and by establishing the formal version of a financial opportunity center. We haven't done as well on member feedback as I would like. We have surveyed our participants, but I'd like to get them more involved in our actual planning process so that we can sort of, understand what it feels like to be a member of one of these programs. We've got great people that are doing the work. They're very empathetic, and they generally understand the situations that people are experiencing, but they don't necessarily know what it feels like, and that there's a difference there. So we want to get better at that. Brooke talked about changing to site-based supervision. I actually got this idea from one of our cohorts in the community of practice that started with having site-based supervision, and she is the executive director of Mahabi Atwa. I don't know if I'm saying that right, but she directly supervised the Tammy and Brooks of her agency. And I think that was an interesting model. We now have this cohort of really strong coaches, but they're almost too segregated from the Head Start sites that they're, with the members they're working with. So we're going to reattach them to the centers, but keep them as a cohort, a professional alliance of sort internally, so that they can continue with their professional development and sharing strategies and experiences. And then we have this ongoing, when you work more intensely with families, you can't work with as many of them. So, throughout we've had an intentional approach to, as an agency, we're serving fewer families, but we're serving them better with stronger, more measurable outcomes. But we really have to make sure that we're balancing with the realities of how much a coach can actually take on. So Brooke and Tammy talked about that earlier, and that's something we will continue to look for ways to reduce caseload. Much of that is related to sustainable funding. We've stretched every dollar we have as far as it can go. Angela talked about our braided funding and how each one of our coaches is funded by those different components. And so there's a level of complexity just simply in doing timesheets. But we're going to need to, I want to take the evidence that we're collecting and use it to apply for new funding and be able to expand beyond just the Head Start families, work more with the housing families, and really anybody that might interact with community action in general. Whole family is not a program, it's an approach to the way we do business. And I want to make sure that we can apply that across the board, regardless of which program somebody might most closely participate in. And then I have to point out that I have an amazing team. I don't have to do the work. I can have these bright ideas and, talk to my friends at the Community Action Partnership and with our national organizations, but it's really the folks that, Tammy, Brooke, Angela, Emily, Beth, Leslie, this amazing team of people that we have, find your leaders and put them to work. That's all I've got, Jeannie.
Well, that's a lot. Very good. We have gotten a number of questions, and we're not going to be able to get to all of them. So if you've got a question, jot Darren and Angela, Tammy and Brooke's emails, one of them down, and shoot them an email. But there were a few things I wanted to surface. And something that I noted, because I know you guys, I've known some of you for a really long time, but you use the term members. And tell us why you say members instead of participants or customers or families. What's that about?
Well, it kind of goes back to my interest in getting their feedback. We all we refer to clients and customers, program participants and things like that, but we want to have the sense of feeling like a family. And you're a member of a family, you're not a participant in a family. And so we use that term to really reflect our interest in them being part of their own solutions.
Great, thank you. And then you mentioned caseloads, and I wondered if you could just quickly talk to us about, I know it's probably a moving target because you do have staff who come in and out, but how many family success coaches do you try to maintain? And have you had good retention with those folks? And if not, what do you chalk that up to? But just anything in that space you can quickly share.
Brooke, maybe you can jump in on this quickly, but we've got, I think, 12 family success coaches. We have now achieved a much greater, or lower level of turnover. Initially, we had a lot of turnover, probably because of the shock that Angela mentioned to our culture. But now we have, everybody that has came on for this purpose of working in a whole family approach. So we've been able to hang on to them. I will tell you that the level of stress and anxiety is very high. This is incredibly emotional work, and Tammy and Brooke do a fantastic job of trying to mitigate that as best they can. But, when you're talking about being trauma-informed, this is the group of people that feels the effect of poverty right up there on the front row. So I think we're at a too good level. Brooke, I can't even think what our actual caseload is right now. Do you want to comment on that?
We average between 30 and 35 on caseloads.
Great. Good. Thank you. And then one last question, and again, please feel free to reach out to the CMC team. They're very generous. Darren gave you a thumbnail of the Bridge program today. That's an awesome program. People may want to learn more about it. They really have grasped that this is an approach, not a program. It's a mindset. But I know you spoke to this for just a minute, and just maybe another minute or so. You talked about recruiting participants and getting this was a mindset change for participants too. And how much have you had to think about recruitment and marketing and those kinds of things?
Well, first, for getting them in, not at all, because we're using our Head Start families as a base of our membership. The challenge has come in really thinking through the level of service that each of those families need. Some of them, they come to us, they really just want childcare so that they can work. They're in a good place. They don't need an intensive goal-setting experience, and others are coming to us, frankly, they're in crisis and they don't know where to turn, and they too don't want, anybody getting into their business. And so the challenge has been figuring out how do we respectfully, engage at the right level. And that's a process that's still going on, but we did create a filtering system. Brooke and Tammy talked about that a little bit, where we sort of gauge their realities. It's hard to put numbers on that exactly, because someone might say they're okay and they're not okay, and others say they're not okay, but they actually are. So that process is a really important part of the answer to that question, I think.
Thank you so much. To all of you, everybody at the CMC team, I just have so much love and respect for your work, and I don't have favorites out there, but I love you guys so much and everything you're doing, and you're a great shining star to everybody in our Community Action Network, and we all have good, hard, important work ahead of us, and so thank you for helping light the way to what's possible. And we know that we're all a work in progress, but it's important to recognize the work that you all have done and that some of your other peers have done that we're highlighting. So with that, we're going to call it a day, and please watch, all of you out there, for our other Leading in Innovation sessions. We have a few more. They're all great, and we appreciate everything everybody's doing, and we'll see you down the road, okay? Thanks. Bye, guys.